Now, SpineCor, on the other hand, is a dynamic system. And since it is a dynamic system, the analysis up front is very detailed. And then when we are applying the bands to the patient, getting them set up, it is also a very detailed system. But the bands provide the rehab. So if the patients, or when, not if, when the patients wear SpineCor, basically all the rehab is being done for it. That is a much more tenable system. Now, on the back end of that, again, since it is dynamic, the patient's posture is going to be changing throughout this as they make improvement. So again, the provider needs to be constantly adjusting the band, not constantly, quarterly adjusting the bands and making changes so that we can get the best outcome for the patient. The provider, they need to be on their toes in the SpineCor system. It's not passive. So when we're applying SpineCor, we teach the patient their movement and we have them hold that movement while we apply the elastic bands. Now, the elastic bands allow for full range of motion. So the patient can move in any direction, full range, no restriction, but those bands very, very gently return them to the corrective position over and over and over. We tell them, and this is backed up by research, that when you're using SpineCor, it's essentially the same as doing 10,000 precision exercises every single day. So when you're doing that, when you're continually moving in a direction, that's going to get neurologically reinforced. Well, how's that going to get reinforced? The receptors in the muscles, in the ligaments, in the tendons, in the joint capsules, they sense all of this movement. They feed that movement up to the sensory cortex of the brain. Sensory cortex integrates that, passes it over to the motor cortex, and the motor cortex then sends a signal back down that, hey, this is the posture we want to hold. And that is how it is neurologically integrated.
How does the brace promote neuromuscular integration and postural change over time?
Okay, Scott. This is the big question. So I've mentioned a couple of times that SpineCor is a postural re-education tool, and it uses the corrective movement principle to affect scoliosis in all three planes. So what is the corrective movement principle? Well, the corrective movement principle is the idea position for that patient to affect their scoliosis. And to understand that, you need to realize that there are 26 classifications of idiopathic scoliosis. So there are 26 corrective movement principles. And so that's part of the upfront work that we do in determining which classification the patient has.
What do patients typically say when they perhaps compare SpineCor to what they've heard about rigid bracing?
Well, certainly if they've ever seen a rigid brace, a SpineCor is much more palatable. But keep it in mind, if you show a patient a rigid brace that's this hard plastic shell and it puts a lot of pressure on their spine, and then you show them these elastic bands, comfort is probably the first thing that patients will mention. And then, and this is especially important with our adolescents, low profile. You have a teenage kid and you can put them into a system, a rehab program that's doing all the work for them. And it's barely detectable under their clothing. That's a big deal for teenagers. And then here in Texas, especially, put somebody in a plastic brace, it gets a bit warm. And so is SpineCor cool? No, it's another layer of clothing essentially, but it is a lot cooler than trying to wear a rigid brace, plastic shell in July and August in Texas.